चलिए ठीक है, मैं वेट करूं या स्टार्ट कर दूं? ठीक है. If you are in touch with Zafar Mirza Sahab, can you please also request him that if he's okay for us to begin the proceedings with Kirat and then introductions, and we can talk about APPNE and the other guests, and then he can join us, or we can wait. That's fine. Okay, so we will start the proceedings in about 5 minutes. Okay, Assalamu alaikum. May I request people to please put their mics on mute? Assalamu alaikum. जी ज़करिया, आपने लिंक ज्वाइन करी, मैं आपको एडमिट करता हूँ. मैं आप आ जाइए. जी मैं वेट कर रहा हूँ. अस्सलाम वालेकुम नफीस ज़करिया साहब.
वालेकुम सलाम. सलाम टू एवरीवन. रमजान मुबारक सबको.
So सब लोग जो है इस वक्त के माइक्स थोड़ी म्यूट पे हैं ताकि हम टेस्टिंग कर रहे हैं साउंड की. और सब लोगों को मेरी आवाज आ रही? प्लीज गिव मी अ थम्स अप बिकॉज़ वी जस्ट डूइंग दिस फाइनल चेक. इफ यू कैन हियर मी स्टिल, थैंक यू वेरी मच. नफीस ज़करिया साहब अभी जस्ट होल्ड ऑन सर. जी हेलो. ओके, आई एम कमिंग टू यू. जस्ट होल्ड ऑन. मैं सबको 2 मिनट के लिए अनम्यूट कर रहा हूँ, सबको एक साथ.
Allow मुझे दो.
I can't hear you very well, Ayaz Abbasi sir.
Can you hear me, Amr?
I can. Everybody's fine.
Can you?
I can't see Ayaz Abbasi sir. I can't see you on the screen yet. Just looking for Ayaz Abbasi sir. Okay. Just bear with me. We are going to come back to everybody. Let's finally check. Ayaz Abbasi sir, can you hear me now?
Yeah, I can hear you now.
Sorry, I can see you now. I can see you now. I can see you very clearly, and video is all right. Thank you very much. I'm just going to go back to Mr. Nafis Zakaria Saab, just trying to find you off the list, sir. Waiting for Mr. Zakaria Saab's camera to. I seem to have lost Sahib on my end. I'm going to try and call him. जी आप अभी ठीक है, मैं आपको मिस कर लेता हूँ. थैंक यू सर. Mr. Nafis Zakaria on that list. I'm going to unmute everybody for just one test, and I only would request Mr. Nafis Zakaria to just talk back to me so I can find his video on the screen. Thank you very much. Just Mr. Nafis Zakaria. Thank you.
Assalamualaikum.
जी नफीस ज़करिया साहब, अस्सलाम वालेकुम।
मेरी वीडियो आ रही है आपको क्या?
जी, अब आपकी वीडियो बिल्कुल मुझे क्लियर आ रही है और आपकी आवाज भी मुझे बिल्कुल क्लियर आ रही है। पहले थोड़ी सी उसमें डिस्टर्बेंस थी, अब बिल्कुल ठीक है। And if the rest of the audience can hear Mr. Zakaria Saab, can you please just raise your thumb so we can make a start? Thank you very much. Thank you. Thank you. Zakaria Saab, Zafar Mirza Saab का मैसेज अभी आया कि वो थोड़ा सा 10 मिनट से 15 मिनट तक लेट रन कर रहे हैं. But he will join. Is happy for us to start. Usman Mushtaq has already joined us, so we can request Usman. I'm going to unmute Usman as well. He's one of our guests. Usman, can you just say hello to us so we can know that you can hear us and talk back to us? Usman, can you hear us? Okay. Mr. Khalid Khan, I am going to unmute you for the time being. Are you there, sir? Mr. Khalid Khan, can you hear me? Mr. Khalid Khan, sir. Usman, I'm still waiting for you to respond to my voice command. If you can hear me, sir, please respond back. Usman Mushtaq, sir. Okay. Asad Malik Saab, can you hear me? Asad Malik Saab, can you hear me? Usman. Okay. Usman, you are unmuted. Can you just say hello to me so I can make a start with the proceedings? Hisham Haq, you are unmuted now. So can you just say hello so I can?
Hello.
Thank you, Hisham. I'm just waiting for Usman to come back to us. Usman, yep. Please accept the unmute Usman. So
Yes. Assalamu
alaikum. And Nafis Zakaria Saab is already on the line. I'm just waiting for Mr. Khalid Khan to come back to us.
Yeah, I'm back now.
Back now. Thank you very much.
Amir Saab, just a very short brief. Dr. Zafar just called me now. He is rushing on the way back from an event, and inshallah he should be able to join us very shortly. But we can get started.
We will get started.
Yes, Amir, is Ambassador Shuja Alam Saab is there now?
I have not seen Mr. Shuja Alam Saab yet. I'm going to admit Mr. Shuja Alam Saab. Yep, I can see Mr. Shuja Alam Saab. So unmute. Mr. Shuja Alam Saab, assalamu alaikum.
जी अस्सलाम वालेकुम, I'm here जी.
आपको मेरी आवाज और तस्वीर साफ आ रही सर?
जी loud and clear.
Thank you very much. शुजा आलम साहब, ठीक है. तो शुजा आलम साहब, शाहिद रफीक साहब, can you hear me?
जी.
I'm just trying to make sure that our invited guests are all
right. I can hear you.
Irfan Akhtar Saab, can you hear me? You are now unmuted.
Yeah, absolutely light and clear. Assalamu alaikum, everyone.
Irfan, assalamu alaikum.
Yes, Sheikh Saab, you are now unmuted. Can you hear me, sir?
Ji, yeah, of course. Bismillah.
What I'm going to do now, I'm going to unmute the executive committee and the trustees of the Association of Pakistani Physicians of Northern Europe, and we will proceed as Usman has said. Mr. Dr. Zafar Mirza is quite happy for us to start. So Usman, I would like you to keep your mic unmuted for the time being. Mr. Saad Saab, I'm going to unmute you.
Assalamu alaikum. I can hear you.
ठीक है सर. थोड़ा सावल साहब आपके माइक में एको है, जरा सा ख्याल कर लीजिएगा. और आयाज अब्बासी साहब, can you hear me, sir?
Yeah, loud and clear.
Thank you very much. क्या साहब आपके माइक में थोड़ा वो आ रहा है फीडबैक आ रहा है तो अगर आप अपना माइक ऑफ करते हैं अनम्यूट करने से थोड़ी देर के लिए इफ्ती हाजी सैयद यूसुफ साहब आपको मैंने अनम्यूट किया हुआ है कैन यू सर
I can hear you all right, but I don't think you can hear me. Can you?
I can. Thank you very much. शुजाला साहब आपको मेरी आवाज क्लियर आ रही है?
जी बिल्कुल loud and clear.
Yes sir. तो इंशाल्लाह ताला we I think all our invited guests are here. Khalid Khan Saab is here. I can see him, and Shuja Saab is here as well, and so is Nafis Zakaria Saab. And I can see Shahid Rafiq Saab clearly, and we can hear him as well. Usman, I can see and hear very clearly. My colleague, friend, and General Secretary Mr. Irfan Akhtar is here, and we can see him clearly and hear him as well. So I'm going to make a start. There are still people joining us, but I'll keep on adding them till we reach the limit of 100 people. We are recording this session, as I said earlier. So if anybody has any problems with their face or the video being either on Facebook Live or being recorded, please, you can only use the audio. Okay, so we are going to start quickly now. Please, I would request everybody to mute their mics if they haven't already. And I'm going to say the names. Can those gentlemen and gentleladies only unmute themselves? So Mr. Khalid Khan, unmute your mic.
Okay.
Mr. Shujala.
There's a lot of echo.
There's echo. So there is Saeed Al-Jawhar, I think it's coming from your mic. Switch on your mic.
Okay.
Thank you. It's gone now. So it's coming from your end. The echo is coming from your mic, sir.
Okay.
Mr. Nafis Zakaria, can you unmute yourself? Thank you. And if you could just say a few words for us, Mr. Nafis Zakaria, so I can know that we can hear you clearly. Nafis Zakaria, sir. If you could unmute yourself. There you go. Sir Zakaria, sir, there you are. Thank you. I can hear you now very clearly, sir. Thank you very much.
Can you hear me now?
I can hear you very clearly. So आप unmute ही रहिएगा sir अभी फिलहाल. ठीक है. Mr. Shahid Rafiq, can you unmute your mic? You are on mute now. Can you just say hello so we can make a start with the proceedings? Shahid Rafiq.
Assalamu alaikum to everyone. Thank you.
Thank you very much, sir. Thank you very much. So, Assalamu alaikum and Bismillahirrahmanirrahim. My name is Dr. Amir Yusuf Berni, and I'm the current president of the Association of Pakistani Physicians of Northern Europe. I welcome you all. Before we go any further with introductions and the proceedings, I would be requesting Mr. Awais Sheikh, our executive member and treasurer of the organization, to do Kirat, and also to do a small dua for the people we have lost and those who are unwell across the world. Mr. Awais Sheikh Saab. You are now unmuted, Mr. Vishwazat. Please accept.
Thank you. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. والعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. अल्लाह ताला हम सबको भाई सही ईमान की और अमर साले की तौफीक अता फरमाए। जो लोग इस दुनिया से चले गए हैं तो उन सब के लिए हम दुआ करें। औज़ु बिल्लाहि मिनश शैतानिर रजीम। बिस्मिल्लाहिर रहमानिर रहीम। अल्हम्दुलिल्लाहि रब्बिल आलमीन अर्रहमानिर रहीम मालिक यौमिद्दीन इय्याका नअबुदु व इय्याका नस्तईन इहदिनस सिरातल मुस्तकीम सिरातल लज़ीना अनअमता अलैहिम गैरिल मग़दूबि अलैहिम वलद्दॉलीन। जो भी पूरी दुनिया में इस बीमारी से किसी बीमारी से बीमार है, अल्लाह ताला उन सबको शिफा दे और उनको अपनी अपनी बेपना रहमत में रखे। जो भी हमारे ईमान वाले दुनिया से चले गए हैं, अल्लाह ताला उनकी मग़फ़िरत करे। अल्लाह ताला हम सब और जो हम सब लोग हैं और बाकी हैं, तो अल्लाह ताला हम सब को अपनी हिफाजत में रखे और अल्लाह ताला हम सब को अपनी हिदायत में। आमीन।
Amin. Jazakallah khair. Thank you for that. I will now introduce APPNE to our colleagues and friends who may not have known much about APPNE or they would like to know more about APPNE. So very briefly, I would like to tell you that we are a nascent organization. We are known as the Association of Pakistani Physicians of Northern Europe. We are the only organization which is panning across Northern Europe from Ireland to Germany. So we have listeners and colleagues who are listening in from Germany, Norway, Republic of Ireland, and across all 4 countries of the UK. We are very happy that we have guests from Pakistan and also from America. Mr. Shahid Rafiq has joined us from APPNE. So Association of Pakistani Physicians, as I said earlier, is a European-based organization, and we are looking to take on board all our colleagues from across the countries which are in not only in Northern Europe, also across other countries. And these are including both first and second and third generation, as well as those who have made Europe their second home outside of Pakistan. So as an organization, we are the first executive founder body, so to speak, and we are governed by 3 or 4 trustees who have also joined us here today. And we are a 50-body executive committee which came into being in February of 2019 last year after an electoral process which took place in December of 2018. So we are a fully democratic organization hoping to represent our European friends, the Pakistani friends who are, as I said, second generation or third generation in Europe, or those who have made Europe their home. So we aim to give them a singular platform to raise voices, concerns, and to come forward to provide solutions both for Europe and also for Pakistan. So basically today's program is thankful to Usman Mushtaq and His Excellency Mr. Nafis Zakaria, His Excellency Mr. Shuja Alam Sahab, our friends and colleagues from elsewhere, and the State Minister for Health, Mr. Dr. Zafar Mirza Sahab, to join us today. And this is to really disseminate information about the Yaran Watan program. And the Yaran Watan program you might have seen on our Facebook pages, which now we are proud to say we have nearly 5,000 members on our Facebook page of the Association of Pakistani Physicians of Northern Europe. We're also on Instagram, we're also part of Twitter. So please do visit those sites and follow us if you can. And hopefully today we will hear from Usman shortly about the program, its concepts, and what the expectations are from the Pakistani diaspora outside of the UK, and how we want to contribute to it. After this, I will be requesting Mr. Zafar Mirza Sahab, Mr. Nafis Zakaria Sahab, Shuja Alam Sahab, Shahid Rafiq, and Mr. Khalid Khan, who's very joined us from Ireland and is the president of the Irish Pakistani Professional Association, to give us their views. We are hoping that we will have about 20-25 minutes of question time as well at the end. I would request all of you to please keep your questions in relation to the Yaran Watan program and the Pakistan Diaspora Health Initiative only. If you do not get a chance to ask your question because of want of time, please send me your questions as a text on the chat box, and I will collate them and put them forward to Mr. Usman Mushtaq and Dr. Zafar Mirza. So I would be first requesting Dr. Usman Mushtaq, who is the team leader for the Yaran Watan program, the Pakistan Diaspora Health Initiative, to say a few words. I've just seen that Mr. Dr. Zafar Mirza has just joined us. So Dr. Zafar Mirza, Assalamu alaikum.
Ji walaikum salam.
I can see you very clearly, Dr. Saab, and I hope you can hear and see me clearly as well.
Yeah, I can hear you very clearly. Thank you.
Thank you. So we have just literally started the proceedings. I do not know at what stage you joined us. So we just had Kirat and the dua from Mr. Avesha, our excuse me, our treasurer and executive member. Before I request Dr. Usman Mushtaq and yourself, sir, to talk to our audience, I would like my executive team member and our trustees who are here with us to kindly state the name and the post within the organization. I'm going to start with Mr. Amir Khan first. So Mr. Amir Khan, if you would like to say hello and state your position.
Oh, hi. Thanks very much for giving us an opportunity. And thanks, Mr. Mirza, for joining us. This is a great opportunity for those people sitting here to have some sort of an idea how we can help to rebuild the structures in Pakistan, especially for the health services. I'm a general surgeon by profession. Thank you very much.
Thank you very much, Mr. Amir Khan. If you can mute your mic. Mr. Shah Qureshi, if you would like to say your post and what you're doing up next, sir.
Thank you very much. My name is Shahullah Qureshi. I am one of the trustees of APPNE, and I think it's a privilege and honor actually to be in the program and to participate. And I think we should be collaborating with the health services in Pakistan. I think APPNE should be going forward with this program, and we should try and help Pakistan as much as we can. I am a general practitioner based in Walsall, which is part of larger Birmingham.
Thank you very much. I'm going to unmute Mr. Irfan Akhtar, please. And if Mr. Irfan Akhtar can tell a bit about himself and say a few words.
Assalamu alaikum, everyone. Do apologize for my voice. My trachea has been violated for some time. I am the General Secretary. I'm a General Surgeon by profession. And seeing all of you, makes me very happy, as I've been working along with Usman for some time on this thing and updating my colleagues here in UK of the merits of this program. I really look forward that this turns out into something substantive where all these talented people, which I can see on the screen, especially have taken time out in Ramadan to help out. And it is a fruitful program both for us and as well as for Pakistan. Thank you.
Thank you, sir. Mr. Afzal Sawal, would you like to say a few words quickly? So please accept the unmute request from my end.
Are you asking me?
Yeah, Mr. Afzal Sawal.
I'm Afzal Sawal. I'm by profession, I'm a pediatric neurologist here in England, and it's a pleasure to work with APPNE. And I'm also the lead for the APPNE subcommittee of education and training. And it's a pleasure to see Zafar Mirza, who's happened to be our class fellows in the medical school. Nice to see you.
Nice to see you.
Thank you very much. Just bear with me. The signal is just a bit slow on my end. Just bear with me, sir.
Yeah, Mr.
Aveshik, would you like to say a few, just quickly, your post and what you do for APPNE?
Hello. Yeah. Hi. My name is Dr. Sheikh, and I am a orthopedic consultant, and I am the treasurer. And this Yaran Watan is, really good. We all here would just love to join, and we all here would love to contribute and be as useful to each other.
Thank you, sir.
Thank you. Thank you.
Ayaz Abbas, sir, would you like to just tell us what's the role in the trust in the organization, sir?
Yeah. Assalamu alaikum. Ayaz Abbas is my name. I'm a consultant in emergency medicine and also divisional director in my own trust. And I'm very much excited to hear about Yaran Watan, and I've been briefed a lot by my good friend Irfan Akhtar. I'm looking forward to work with all of you for my country of birth, and I'm really proud to work with everyone who can improve the health services back home.
Thank you very much. I'm going to unmute Ms. Sadat Jafar Boy. Ms. Sadat Jafar Boy, can please introduce herself quickly, and then we can move on with the proceedings.
Assalamu alaikum, everyone. I'm Sadaf. I'm an executive member, and by profession, I'm a breast surgeon. It's an honor and privilege for APPNE to collaborate with Yaran Watan, and I look forward to some fruitful work for Pakistani population.
Thank you. Mr. Naseem Waraj, sir.
अस्सलाम वालेकुम जी, मेरा नाम नसीम वड़ाइश है, मैं कंसल्टेंट सर्जन हूँ यूके में, और I think it's a very nice platform that we can learn mutually from each other on the basis of this Yaran Watan platform. Let's hope how it goes. I'm an executive member of APPNE basically.
Thank you. Mr. Sayyid Iftikhar, sir.
Assalamu alaikum, Amir. As you know, guys, my name is Iftikhar. I'm associate professor and consultant surgeon with a special interest in upper GI surgery. With a number of my colleagues, especially Amir, who spoke first, we have been training and teaching in Pakistan for the last 20 years in every city of Pakistan, Karachi, Lahore, Pindi, Peshawar, and Kashmir. And we would like to channelize this energy through Yaran Watan if it's possible, and that will be a good thing. Thank you.
Thank you. Hisham, sir.
Assalamu alaikum everyone. My name is Hisham. I'm the social secretary for APPNE, and I would like to say a big thank you to all the participants over here as well, because this is a strength for APPNE, the fact that we can actually work as a platform to welcome everyone. So thank you everyone for being here.
Thank you very much. These are the people I can see from my executive team and trustees on my screen yet. So if anybody of my trustees or executives I've not seen or haven't mentioned, can you please text me so I do not miss you off my list? I would also like to introduce our other invited guests. So we have Mr. His Excellency, the High Commissioner from Pakistan to the United Kingdom. He's joining us today. Thank you, sir, for joining us. We also have Mr. Shuja Alam, His Excellency, the Ambassador from Pakistan to the Republic of Ireland. And thank you, Mr. Alam, for joining us.
Thank you.
We have Dr. Usman Mushtaq, who very kindly has actually instigated this whole webinar by having a conversation a week ago. So thank you. And finally, Mr. Shahid Rafiq, sir, thank you so much for joining us on behalf of APPNE and APPNE Merit. He's the lead and chair for APPNE Merit. He's a neurologist and specialty sleep medicine and stroke medicine.
Thank you.
Finally, Mr. Khalid Khan, if you can still, you are there, so I will unmute you and keep yourself unmuted throughout the proceedings, sir. So Mr. Khalid Khan is a consultant orthopedic surgeon who is also the president of the Irish Pakistani Professional Association. And we are very proud to say as APPNE, they were our first MOU outside of Pakistan.
Thank you.
Welcome. So welcome everybody. Without further ado, I'm going to go to Mr. Dr. Zafar Mirza, sir, the State Minister of Health and the Special Advisor to the Prime Minister of Pakistan. And thank you, sir, for giving us your time. And I would like you to say a few words to our participants here as well, and then request Mr. Usman Mushtaq, who is the team leader for Yaran and Watan, to do the presentation as agreed before. So thank you. So over to you, sir, and then to Usman Mushtaq.
Bismillah ar-Rahman ar-Rahim. Janab Dr. Amir Bani from APPNE, Mr. Nafis Zakria, High Commissioner of Pakistan in UK, and Mr. Shuja Alam, Ambassador of Pakistan to Republic of Pakistan, to Republic of Ireland, the office bearers and the members of the executive team of APPNE. Assalamu alaikum to all of you. I must also recognize Dr. Shahid Rafiq, who has, as a special guest, joined from US. Well, I was just thinking about APPNE and Yaran Watan, and I was just thinking that if we combine the two, it reads beautifully, because you will call it APPNE Yaran Watan. So this goes very well with the ethos and the spirit with which we have launched Yaran Watan. You can hear me clearly?
Yes.
Okay. Well, I will very briefly touch upon the situation that we are in and government response to it. And then I will turn to Yaran Watan itself very briefly. And then I hand it over to Usman. And I would really like to have some interactive part of the session, although I have to leave a bit early. So if we can manage our time well, I think we can cover all the items. So, well, Pakistan, being one of the countries in the world, is going through a difficult time. We had our first case of COVID-19 on 26th of February, but we started working from 15th of January. And I think that early start has helped us. Obviously, the first phase was to prevent the entry of the virus in the country. Although sandwiched between China and Iran, we were not in a good place to be, but we managed it quite well, I think. But then gradually, as it happens, it started spreading, and as we speak today, our figure for local transmission versus imported cases is 87%. So 87% is the local transmission. So essentially, the outbreak is local now. I'll spare you with all the details, but I think what is most important is that everybody wants to know that how we are managing and what next. I'll also not repeat the numbers, because the numbers about COVID virus, COVID-19 has become a new kind of stock exchange which keeps rolling in every country, and everybody by heart know the numbers. I'm sure all of you know about the state in which we are in Pakistan right now. But the key thing here is that the cases, confirmed cases are increasing. And the number of cases increasing is a direct function of how much tests we are doing. And the number of tests we are doing, last 24 hours, the figure was highest in a day, which is 13,000 tests per day, which we are hoping that we will exceed 25,000 in coming week or so, or maybe 10 days. This has been a massive effort. When we started, we had only 3 labs which could be used for PCR testing. Today, when I speak with you, we have 68 labs spread all over the country. We started with 472 tests on the 15th of March. Last 24 hours, we did 13,000. So cases is always, whatever number of tests you do, the cases that you have still represents a different size of the tip of the iceberg. The real, is submerged under. So there are various estimates that for one case you have 8 to 10 cases which you don't know, and as I said, the infection is spreading now. So the time has come that where we can start thinking about having a larger prevalence study or serological study, which also tells us about the level of immunity. As far as the natural history of the COVID-19 is concerned, we all know this, that a large proportion of those who become positive have only mild to moderate disease. The number of patients who go into critical care, global average is 4.8. We fortunately until now has 2.5. We have, for the first time, as every challenge has an opportunity, our opportunity was to put our house in order in terms of health information and disease surveillance. So this we have managed. I think every day we are improving it. Still, it's not, we are far from perfect, but the kind of information that we have today, we never had before. So as a result of this, we more or less know the number of ICU beds in the country dedicated to COVID-19. We know the number of vents available. We know the number of HR. We know the number of, even we know that we have started assessing the needs of the personal protection equipment, kits, machines, tests, etc. So the system is shaping up with every passing day. How the future looks like? We have 4 different groups who are making different kinds of predictions using different methodologies. We have brought them together, and they help us to see next 30 days at least how they would look like. The methodological limitations do not allow us to have more reliable predictions beyond 30 days, which is the case more or less in many other countries. But the good news is, well, good news in inverted commas because it's all relative. The good news is that even by the standards of, even by our own predicted numbers, we have less cases and we have less deaths. And this has been the trend all along. And every week on Tuesday, we do new predictions based upon what the numbers that we have. Definitely India, Pakistan, Bangladesh, for that matter, South Asia, is representing a different kind of evolution of the outbreak for a number of reasons, some known, most not known, but I do think that we are lucky to have this slowly developing outbreak, which gives you more opportunity to control it and prepare for it. So that's what it is. Let me now briefly tell you about Yaran and Watan, and then I will hand it over to Usman to tell you how it works. Well, Usman, can you change the slides?
Yes,
well,
slide is not rolling, so people, yeah, there you go. Thank you very much.
Yeah. So the thing is that Pakistan, has a deficiency of health workforce, of doctors, of nurses, and actually doctor-nurse ratio is upside down in Pakistan. And as a health system person myself, working in World Health Organization, we were always dreaming about this idea that how in developing countries, our most bright doctors who leave these developing countries, how we can entrust them back channelize their contributions to the health development in developing countries. It's not easy, but it's also not impossible. So this was also, one of my health system thing that I always wanted to do this. And we started working on this idea of Pakistan Diaspora Health Initiative pre-COVID days. And the idea was to establish it as a platform where we can bring our more than 30,000 physicians outside Pakistan. But then COVID came and it changed everything. And then we immediately also reconfigurated Yaran Watan, as we call it, as a kind of COVID-19 version of it. And we thought that this would be a good launching pad for this initiative. And we launched it about 2 weeks ago. Prime Minister knows about it. He's very happy about it. We have his full support. A couple of days ago, I also did another webinar with the APPS. And now we are talking with you. We have a couple of others lined up. So the basic idea is that my own experience is also that especially our doctor community outside Pakistan, and they always want to contribute in a systematic way, where they can show impact, where they are facilitated, where they are recognized. But such forum inside Pakistan was not available. So until now, there has been group efforts, individual efforts, some very successful, some not very successful. So when I conceived the idea, I thought that how government can, hold the hand of our doctors abroad, how we can facilitate them and recognize them and channelize their contributions in Pakistan. So this is the underlying basic, very simple, without being simplistic, vision to realize the full potential of the diaspora community for health sector development in Pakistan. And can we go to next? I think I have covered a lot of these things. We think that it's a huge opportunity because all of you, 30,000 of you have been part of those well-developed health systems where you have experienced how a better health system, more resourceful health systems are working. And all of us in our, our VNs, we want to see in Pakistan also a system which delivers and which, reaches to the people with reference to their health needs. So we really think that if we properly, manage this, this can go a long way. I must also say that when I say health diaspora, I do not mean only physicians, but all health professionals. It includes nurses, it includes pharmacists, it includes physiotherapists, it includes other paramedics. So this is basically what it is. Come COVID-19, and we basically started thinking about it, and then we launched it. The basic idea is that we encourage doctors abroad to register with us by filling in a very simple questionnaire where you tell us about your interests and about your possible contributions, whether as a person, whether as a group, whether as an association. And the same kind of thing we are doing inland in Pakistan. So until now, and Usman will give you the more granular figures, we have about 1,900 plus doctors already registered in last 2 weeks. And we have more than 100 institutions in Pakistan, which we have also brought to this forum. Our job would be, as government, to actually try to act as a matchmaker between contributions that can come from all of you and others abroad with the local needs, and try to do these kind of matchmakings where optimal outcomes can be achieved, maximum outcomes can be achieved. So, and apart from this, until now, there have been some efforts before under Higher Education Commission. There was a Top 10 initiative, but specifically for doctors, there had never been a platform established by the government for doctors abroad, which invite them to be part of the effort of health development in the country, but also at the same time facilitate their contributions. This is very important word, facilitate their contributions, and also recognize them. So my view is that if, inshallah, we move in this direction, and it continues, we will be having, inshallah, an annual gathering of doctors here where we can bring the head prime minister or the president and, recognize the major contributions and celebrate you as us who are outside and who are more experienced and knowledgeable of well-developed health systems, and by working with them and being part of them, to channelize your interests and contributions back home. So that's what it is. Usman can now take you through with a couple of slides that how more it works. What I can also tell you is that at the moment for COVID-19, we are very, very concerned about the anxiety and the fear factor that our health workers, frontline workers in Pakistan are facing. We have redoubled our effort to reach to them with ample supplies of personal protection equipment, but our problem is irrational use of the personal protection equipment, and there are many gaps between hospital managements and doctors. We have developed our guidelines, we have developed our supply systems, But with the growing number of infections in doctors community or health professionals community, frontline workers, it's about 2.7% of the total positive patients in Pakistan. 2.7% are doctors. This figure was about 10, 11, 12% in some of the European countries. So it's inevitable that some of the frontline workers will be infected. And obviously there are some unfortunate deaths. And I really want to do something very meaningful for our doctors and health professionals here. I'm working on a national campaign on protection and support of our frontline health workers. And the title of this campaign is We Care. And major part of that will be to conduct specific sessions for hospitals through webinars on training about the use of personal protection equipment. So this in particularly I wanted to mention this because this bothers me a lot. So I'll stop here. Usman, over to you. If you can quickly run a couple of slides and then we can proceed with the rest of the program. Thank you very much.
Thank you, sir. Thank you very much. Before Usman moves on, my three other colleagues have joined us, and I can see them. Dr. Mem Mirza from Abu Dhabi, our Joint Secretary, and Imran Gangro, and Mr. Ayub is here as well. So can I just request them before we move forward for them to just say hello and introduce themselves to the team, please. Mem Mirza, please. Mehboob Mirza, if you can hear me. Okay, I'll go to Imran Gangro. Imran Gangro. If Amar, you can hear me. Amar, you can just say hello to us, please.
Yes, Assalamu alaikum. Can you hear me?
Yes, we can now. Yes, please. Please carry on.
Yes, Assalamu alaikum. Dr. Amir Ayubji, cardiologist in Manchester. Absolutely delighted to be on this forum. And thank you very much, Zafar Mirza Saab. Very informative slides. And we are very keen to work with you. Thank you very much.
I think I'm losing audio for Mr. Mehboob Mirza and for Imran Gangro. So if Imran Gangro can hear me, just please introduce yourself so we can move on, please. Thank you very much. So shall we move on to Dr. Usman Mushtaq, sir? So Dr. Usman Mushtaq, thank you for waiting and please carry on.
Thank you so much. Assalamu alaikum, everyone. Thank you so much, Dr. Zafar, for laying out the vision and allowing us to work on this. I just want to start by saying that this has been a tremendous collaborative effort with many resourceful people outside of Pakistan, both organizations and also a lot of people that are in the call here. And I would just like to recognize Nadia from who is a champion and advocate for pharmacists and their contribution into Pakistan, and also Dr. Shahid Rafiq, who's been and APPNE has been quite a lot of help. And it's great to see Dr. Irfan healthy here. Welcome. I'm really glad to see you, and thank you so much for your early support and mentoring. So Yaran Watan's main ethos has been that we want to work with basically everyone and anyone that want to contribute to health sector development. Initially, when we envisioned the initiative, we envisioned it as an institution, but as Dr. Zafar mentioned, in light of COVID realities, we decided to launch the platform which allows for a direct contribution towards the Pakistan's efforts towards fighting COVID-19. And initially, given that flight operations are not resuming, we focused on digital health. So before launching, we did a careful selection of which organizations and private companies that we want to onboard that could put on these volunteering opportunities. As Dr. Zafar mentioned, this is a matchmaking platform that we have created. So on one side, on Pakistani side, you have the organizations and and companies that are providing free of cost services during the COVID-19 pandemic and pushing telemedicine and digital health solutions in deprived and rural areas. And on the other side, you have overseas healthcare professionals. So we onboarded 9 in total, and we also had government initiatives involved. And all of these private companies, Sehat Kahani, doctors, and others, they came into an agreement with us that all the services that they were going to provide were free of cost, and the fact that they were going to push for digital health solutions for the most deprived communities in the country. Currently, we have roughly 35 to 40 unique volunteering opportunities up. It's quite important for us to mention that obviously these current volunteering opportunities won't be suitable for everyone, but they do cater for quite a wide, diverse range of backgrounds. We have a very strict criteria on who we let onto the platform on Pakistan's side, and we obviously do the vetting on the overseas health professionals as well. And we're using this as a pilot project, as you can say, to streamline our efforts and make it more automated, so a higher number of exchanges can take place. At this moment, after 10 days, we have had, alhamdulillah, roughly 200 applicants, and 100, around about between 100 and 150 of them are being engaged as we speak at the moment. So that's only after 10 days. And these numbers are increasing on a day-to-day basis. Just very, very quickly, I know that the medical fraternity is not always the most tech savvy. Just to explain you how the platform works, so you can explain it to your members, and maybe, you know, if you haven't signed on, maybe you can sign on and share the link to other people. The platform is very simple, it's very lean, and when you land on the front page, basically it gives you an option of exploring what the initiative is and directly signing on. So you sign as on as a health professional, then you come to a standardized dashboard where you can build your profile. Basically, you'll see a PMDC license status icon as well. That is inactive as for now because we're not doing clinical missions into Pakistan. But when that opens up and flight operations open up, inshallah, we're working towards integrating a PMDC license renewal system and PMDC volunteering licensing for those who don't have it, in order to cater for overseas healthcare professionals who wants to come and work in Pakistan and do it legally. Basically, the profile mechanism is very simple. There's a personal information and there's a professional information. All of these things are very useful. I can also let you know that we have very strict privacy. We follow very strict privacy rules. So all the information that you share here is not shareable outside of the NITB, the database that we have, which we are working on encrypting with SSL. So feel safe when you share information here. On the opportunities, so one of the things that you can see on your dashboard is opportunities. This is basically where you'll see the volunteering listings, and this is where you can go in and read about you know, the various volunteering opportunities that is out there. You can filter them for your type. I mean, obviously, as medical professionals, that would be it. But I can also mention that for public health professionals, you know, there are specific volunteering opportunities with the Health Services Academy, and this is increasing also week by week as we are onboarding more and vetting more Pakistani institutions that are signing up to the platform. Basically, it's very important for me to highlight that the actual exchange and the actual agreement does not take place on the platform. So we cater for it. We create the letter of acceptance. We make sure that there is quality and quality protocols are followed by the receiving institution. But then the actual exchange take place off the platform, and the organization or the institution then directly deals with the accepted candidates. There is also a possibility for you to create your own availability. So let's say if you cannot find a volunteering opportunity that is suitable for you, you can let us know from when you're available, and this will be then available to the health institutions, and they can pick overseas healthcare professionals according to their needs. This will obviously be more and more refined and will be a lot more interesting when people start coming in and flying into Pakistan, because basically then you'll be able to tell us, hey, I'm coming into Pakistan for 2 weeks or 3 weeks period. I will be at this place and I can do some contribution. I can do some volunteering if there is a need. Yes, I think that's basically the short end of it. I can just let you know that we are constantly running out updates, and already next week we'll be running out the 1.1 version of the platform and the website. And I mean, most of you won't be able to see it, but these are incremental changes that are taking place. Inshallah, within the next few months, and when the flight operations open up, we will also keep an option for clinical and non-clinical missions in Pakistan. And we are working closely with our other health professionals, like our pharmaceutical and nursing diaspora community, in order to make sure that we also use their potential for health sector development in Pakistan. One major milestone that took place actually yesterday was a MOU that was signed between UN Migration and the Ministry of Health, where Yaran Watan was a key pillar of that collaboration. So we'll be receiving technical support from our multilateral agencies like UN Migration, UNDP, and WHO. This is the fast version of the platform. If you have any questions, feel free to reach out to us at any time. My contact details will be available. I'll make sure that Dr. Amir gets them to you. Thank you so much.
Thank you so much, Usman, and thank you, Dr. Salam Mirza, once again. I have got two of my colleagues who have joined us. Ma'am Mirza, if you can hear me, please introduce yourself.
Yes, I can hear you now very clear. Thank you very much, everyone, and greetings from UAE. I'm actually on a sabbatical here from UK, and I just wanted to let you know that there is a very large diaspora, medical diaspora in United Arab Emirates, and these also need to be tapped, and Pakistan Association of Dubai needs to be contacted to actually facilitate the process of Yaran Watan in this area.
Thank you. Imran Gangru, I can hear you now, so can you hear us?
Yeah, thank you very much. Imran Gangru, I'm a consultant gastroenterologist. Thank you very much. I think we're very much excited and about this program, and hopefully we'll work together and how we can contribute. So it's an excellent opportunity for everyone. Thank you.
Thank you very much. I shall be moving on rapidly forward. So I did book this meeting till 5:15. I'm trying to increase the time, but I think it might just roll over. So I'm going to request Mr. Nafiz Zakaria, His Excellency, the High Commissioner of Pakistan to the United Kingdom, to say a few words, and then we move on to Mr. Shuja Alam, please. Thank you very much. Mr.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, and greetings to everyone, all the participants. Minister Saab, thank you very much for enlightening us with your vision. And of course, Dr. Usman, thank you for a very candid briefing. Amir, congratulations for this successful initiative. You have just met the objective, very objective of Yaran Watan, that is connecting the diaspora to Yaran Watan, those who are managing from Pakistan. We are very proud of our community. They have contributed significantly, especially the doctors community, in this crisis situation, in the being in the forefront. And they have actually, I want to avail the opportunity to express my condolences through your organization, to all those families who have lost their dear ones, especially the doctors and the health workers and the medical professionals. I have been actually tweeting about them, and I've been writing letters of condolence to them. I just want to tell you a few things about what the situation is. Now, besides APPNE, we have very other organizations of doctors, and I'm very proud to say that we have a significant share in this doctors community in United Kingdom, and they're playing a fantastic role. So I think Yaran Watan can definitely benefit from them. This COVID crisis, on one hand, has given us a lot of trouble to the human beings, and in terms of economic losses, it has also actually afforded opportunities which we need to look into and cash in. For example, this shift, since we have, if I'm sure, bear with me, that we have, in economic sense, we have lost a lot of contracts which we used to have with the United Kingdom for the textile products and many other products. But then it has also opened up doors for new products, and in this regard, especially products related to the medical field, like the PPE. And I'm sure that very soon, in you'll hear from the government of Pakistan that they are going to open up doors for the export of PPE, because we are moving towards the stage where will become the self-sufficient in this regard. And in this context, I would like to seek help from the doctors community in United Kingdom to help us make ingress into this market in United Kingdom for this PPE. I'm already working on it. I have prepared a lot of ground for this. You can also, you may have heard that the engineers community in Pakistan, there's a big group which has come forward to repair the ventilators in Pakistan, and that has helped quite a lot. And I think that has also contributed to the success which Pakistan government is claiming in terms of checking the spread of coronavirus. You can also check from here in this country, because there's a shortage of manpower here. There's a huge issue. So you can let us know if there are large number of ventilators which need repairs, and Pakistan engineers have offered their services to me that they can come forward and they can come visit the United Kingdom to repair those. I also want to ask you if you could do some sort of analysis of those who have succumbed to this COVID-19. What are those reasons of their vulnerability that they succumb to this COVID-19? I'm just quickly going through this, and so that we are able to create awareness programs for those who would be definitely vulnerable, and they can actually it could be fatal for them as well, God forbid. Also want to inform you that there's a global initiative which is being hosted by the United Kingdom, and it is basically to support the Alliance of Vaccines. You know about it, Gavi. On 4th of June, there will be a global summit which they are organizing, and hopefully Pakistan will be participating in that. And this is one rare opportunity where the Western world has come forward to offer sharing of research and also make the the developing countries as part of the research which they will be undertaking, not just to find vaccines for COVID-19, but also vaccines for the viruses which they anticipate would be coming in the future. So I would like to separately consult APPNE and the other doctors community members to let me know if they have any views, and which we can pass on to the Prime Minister of Pakistan and of course the Minister Mirza Sahab, so that they can benefit from your views as to how to make maximum from this. And also lastly, I think we need to for Yaran and Watan managers, that we need to ascertain the deliverables and also develop a review mechanism to see how successful this Yaran Watan could be and has been, so that we can engage more and more Pakistani community members abroad. It's not just the doctors who have been contributing. I want to pay tribute to Pakistani community by and large, who have come forward to help humanity, to help the NHS workers, and to help the health workers all across the country. Thank you very much.
Thank you, sir. Thank you so much for your words. May I request Mr. Shujalam, please, to say a few words?
Ji, Assalamu alaikum. First of all, thank you very much for the invitation from APPNE, and thank you, Minister, for giving us a briefing. I won't take much of your time, but I'll tell you, the Pakistani community in Ireland is known by the doctors, number of doctors that they have, and they are at the front line of fighting this epidemic inside Ireland. Other thing is, I think this initiative, Yaran Watan, is exceptionally good, because I've met a number of doctors here who were ready to volunteer, give their time and their expertise to impart skills in Pakistan. But they had to go individually and find various hospitals, various institutions, and find a place where they can fit in and where they can contribute. But I think that, which was always quite difficult. And now with this initiative, I hope that the aspiration that the Pakistani doctors in Ireland have would now be met through this this initiative. So my best wishes to APPNE, to the initiative of Yaran Watan, and to doctors from Ireland. And I hope that I'm sure that the doctors from Ireland will contribute very positively towards this. Thank you.
Thank you, sir. Thank you so much for your kind words. I request Mr. Shahid Rafiq from APPNE Merit to please say a few words.
Ji, Assalamu alaikum. Thank you for inviting me. It's been a wonderful journey with the Yaran Watan, with Usman Mushtaq, Dr. Zafar Mirza, and the people in UK. I know Irfan and I met back in Pakistan, and we were talking about it in PIMS. Irfan, it's good to see you recovering. And I salute the frontline workers, especially in UK. A lot of them had laid their lives in this pandemic. Now, I wanted to quickly touch on Dr. Zafar Mirza's point of frontline worker in Pakistan getting anxiety and feeling nervous, and that's not unique to Pakistan. People here also are suffering. I think a famous case of a New York ER physician committing suicide caught the headlines. So towards that end, APPNE and with APPNE, with Professor Tayyib Tahir and Doha, Professor Waqar Azim have developed a program for Pakistan front worker support. So that webinar will be airing next Sunday, actually on May of 18th, supporting frontline workers. So that would be webinar followed by one-to-one institutional support, starting with the Rawalpindi Medical University in Holy Family Hospital, and then replicating it in different hospitals and other parts of the Pakistan. Finally, last point I want to make is that Yaran Watan is very good. I've registered the platform for individual physicians who would like to participate and play their role in Pakistan. For example, doing a consultation via telehealth and things like that, or one lecture or one workshop in an institution in Pakistan. But I would like to invite attention of Dr. Zafar Mirza and Mushtaq that developing programs will need the higher level of collaboration between the organizations like APPNE and APPNE in US and Government of Pakistan and Yaran Watan. So that would be a little different, I would say, than the existing setup. And I know that it's a work in progress, but I just wanted to highlight that. And case in point is Dr. Zafar Mirza, the ICU Vent Management Program that we started talking to a Pakistani group like 3 weeks ago, but it's at a stalemate. So people here, then they're emotionally, they get fizzled out. So I think same in UK, I already talked to Amir Barni. There are so many intensivists from their group that would like to participate in. And we created such a time that would be feasible for UK, Pakistan, and US. And that would be weekend. So I would like to say that I know, Dr. Zafar Mirza, you're very busy, but if there is any other point person, whether it's Usman Mushtaq or somebody else, that we can reach out and keep the things moving. Thank you.
Thank you, sir. Shahid Rafiq sir, thank you very much for your words. I will now request Khan from Ireland to please say a few words and we can move on.
Assalamu alaikum, everybody. Now, it's been a pleasure to be part of this conference and very successful by APPNE. Thanks to Minister Dr. Zafar Mirza, His Excellency Nafis Zakaria Saab, His Excellency Shuja Alam Saab, Janab Dr. Mushtaq, Shahid Latif, and all executive members, Amir Barni and Irfan. It's a hard time for the world. On the same time, Pakistan have done well, whatever so far in the crisis. We are working on the front line, as Shuja Alam have said, in Ireland, in all countries. And we're a group of Pakistani professionals, especially doctors, but we also include some other professionals. That's a strength of our organization and been used very well. And I'll suggest the same, that with this collaboration in Pakistan, if we are doing for doctor collaboration, giving the opportunity, there are a lot of other professionals which are allied professionals for doctors and help in building up a system there. And this will help. Again, we are in the middle of COVID, nearly, hopefully it will be over soon, but long term, probably we might have to look after the Pakistan system into two different ways, with the all input coming from people from abroad and people in Pakistan, and collaborating as a short-term crisis and a long-term crisis. We are very happy, and all of my friends and colleagues in Ireland will be very happy to part and help Pakistan, and we've been doing it individually, as Dr. Zafar Mirza has mentioned. And I'm lucky in a way that I got an opportunity to work in Pakistan in 2013, Aga Khan, as assistant professor. And I did start a Foot and Ankle Forum there. So this way I know everybody try to do whatever in different ways, but as a collaborative effort, it will be much effective with this Yaran Watan program. Thanks very much.
Thank you very much, Khalid sir. Mr. Irfan Akhtar, my General Secretary, my dear friend, and I'm so happy that we have you back on screen. We were very worried, we must be honest, but here we are. So thank you for joining us, Irfan. You are recovering at home. Please say a few words, and then I'll request Mr. Sahal to say a few words.
Bismillah ar-Rahman ar-Rahim. Firstly, thank you everyone for all the well wishes and prayers which kind of helped me through my rough time. But Alhamdulillah, I'm back and recovering and getting better every day. It's been a pleasure to be part of APPNE for almost like 2 years now, and certainly it was a pleasure to meet Usman when I came back to visit him in his office, and we had a good exchange of ideas. Similarly, Shahid, yes, you reminded me, it was the brainchild, which we talked about while we were in PIMS with Tanveer Khalik, and we kind of, was working on it in the background anyway. Firstly, I would congratulate Zafar Mirza on his wonderful efforts of keeping this thing down. While you told us about the numbers, but what you never told us, what's the trick you had that you control these numbers so well, whilst we in UK have very humbling results, I must confess. So please share us, how have you managed that, and why Pakistani people are doing so better than the population at large in UK, and equally better. We have lost about 204 healthcare professionals up till now, and 7 of us were very dear colleagues of ours, consultants who could have given so much and had so much to offer to NHS as well as to their families, but unfortunately lost. So my heart goes for them, and we pray every day for their maghfirah and give sabr to their families. Coming to the Yaran Watan program, and I think I shared these with Mushtaq when I met him. One of the concerns, and I would go to very basics, is that there are plenty of ideas. I mean, you can see the talent sitting on these screens. I mean, they're all highly reputable professionals sitting there. It's communication. The ideas get generated, they're passed on, and then they kind of, many of them go into computer and nothing follows up. So I think a lot of people have approached me about what would be the mechanism in black and white, because some of them have written to you, Mushtaq, and some have written to you, Zafar, but it hasn't translated into a reply, or it hasn't translated into any action. And what reassurance we should have that while we have got all the best wish and will and enthusiasm to join you, that our ideas promoted by the colleagues do get listened to or acted upon. I mean, I'm sure there is only that much that can be practically done, and things would improve as they evolve, as any other system. But let's hear from you what can be done about it, and what's the thought process which you have put into your program.
Thank you, Irfan. Before Zafar Mirza comes back, I would like Mr. Sawal to say a comment, because he's been waiting. Mr. Sawal, if you want to raise a comment, and then we'll ask Mr. Zafar Mirza to say some words.
Thank you. I suppose one of the most important things is in whole this scenario, we should not forget the children. and which is the very important part of this COVID-19 situation. Although initially it was been thought that the children was not been as affected as the adults are, but now we are seeing many children who have got a very serious complication following the COVID-19 infections, and also a lot of children with mental health issues by staying at home, not going to the schools, the lot of restriction on them, playgrounds are closed. I mean, there are many things that the children was not being. So I think in this whole situation, whatever, I think I'm sure Yaran and Watan will go and do a great job, but children or the children well-being should be the integral part of that program.
Thank you, sir. Mr. Amir Khan, would you like to say a comment, and then we can move on to the next?
Amir, thank you very much for giving opportunity, and I must thank the team led by Dr. Mirza, who's developed this program, because I think this is a great opportunity, because a lot of the doctors who are healthcare workers who are living abroad now, we find this is one way of our paying debts back to our country and at least do an education from here. I think I'll just try to get away from the COVID discussion and try to talk about long-term where we are heading, basically. One of the things positive which has come through the COVID-19 is that at least we have realized that a lot can be done through telemedicine. You don't need to have a face-to-face every time. And also education-wise, if you see most of the clinical meetings now internationally are being done through the technology rather than people being personally present. So this will give us more opportunity to, rather than just traveling there, even from here, we can participate in that. So I think this will be a great opportunity for that. While Dr. I've got you there, I just wanted to ask a quick question, because I am very much involved here with the medical training initiative, which we started with a College of Physicians and Surgeons in Pakistan. We bring the doctors here for 2 years training, and then they go back. One of the problems we are finding is when they go back, they do not have a place to continue their training. They do not have a place where they can contribute. Somehow, these people can be used very positively if the system works with it. So I think that is an area where I would like you to do something and help us to take it forward. Many thanks.
Thank you so much, Mr. Amir Khan. I would now like to request Mr. Shahid Latif to say a quick few words, and then we move to Mr. Tayyib Tahir if you can. Just, I'll try and unmute Mr. Shahid Latif. Just bear with me. My system is running slow on this end. Before we go, as I said earlier, we did plan this to end at 5:15. We are hoping it will roll over. If it doesn't, then my apologies in advance. But I will take all of these questions back to Mr. Zafar Mirza and Usman Mushtaq. I'm trying to now unmute Mr. Shahid Latif. Shahid, are you moving from my end? Can you just...
Can you hear me, Amir?
Thank you. Thank you very much, finally. Thank you.
Thank you. Yes. Thank you. Assalamu alaikum to everyone, and a fantastic initiative and much appreciated to Dr. Zafar Mirza and all the participants and our friends from American Ireland and the Middle East, etc. I'm a consultant psychiatrist and clinical director working in the UAE as a consultant for over 12 years. And one of the work that we've been doing recently is with the BAME community, and that is basically us included in that. That is the Black and Asian and multi-ethnic community. I think one of the areas I think we focus on, and this has been touched on already by Usman, and that is our frontline workers. Not only the frontline workers, but also those families, and the kind of impact that this has on them from a mental health perspective. There's something that we've developed here for our workers, which is called the COVID struggle. And this is something that we picked up through surveys. And these are very, very basic things which people feel very embarrassed to talk about. And I'm not talking about individuals who suffer from mental disorder or mental illness. These are people like you and me who have experienced distress, dysphoria, anxiety. And I think it's really, really important to pick up the mental health aspect of this. I'm sure there's a lot of work going on in Pakistan. There's a lot of work going on here as well, and I think this is a great opportunity for cross-learning. Thank you.
I'm going to go to Ms. Nadia Bukhari. If Nadia Bukhari can raise a comment.
Yes, I just have a comment. So I'm probably one of the only non-medical doctor here. I'm an academic pharmacist at UCL and a chief pharmacist at Doctors, which is one of the leading telemedicine companies in Pakistan. So firstly, I just want to congratulate the minister on this fantastic initiative, but also the driving force team. So Dr. Usman, Dr. Bisma, and Dr. Kiran, amongst others. I've actually been in discussions with Dr. Bernie with regards to Yaran Watan and how we can engage more healthcare professionals other than doctors, as well as nurses, pharmacists. And myself being professional, but also the Yaran Watan point of contact for doctors, we're committed to make Yaran Watan a success and to engage all professionals from doctors, pharmacists, and nurses. So a huge congratulations to everybody. Let's do this.
Thank you very much, Nadia. And as you rightly said, we will inshallah work together collaboratively with doctors and our nursing healthcare force as well. Mr. Tayyib Tahir, if you would like to raise a comment.
Can you hear me, Amir?
Yes, we can. Thank you.
Thank you very much for giving me this opportunity. I'm a psychiatrist. I work as a liaison psychiatrist. I work in a general hospital. So I'm in a very unique position in comparison to many others, that I sit on two different stools. I sit in a stool of physical health as well as mental health. So it's important not to forget that physical health and mental health go hand in hand. Forget about this COVID now. This is there. We are going to live with it. But we need to make plans for long term. I've been involved with earthquake 2005, 2006. Things happened, we moved on, but this is not going to change. I'm involved in a UK-wide program for these field hospitals, the so-called Nightingale hospitals, and people working in intensive care for impact that is that we are witnessing now on mental health of our colleagues. I would not want to suggest that I want to replicate that in Pakistan. Dr. Zafar, I've been working with a friend of yours, Dr. Marul Isnan, for the last 4 or 5 weeks in Madhadrana in Pakistan. We need to learn a lot from what's happened in Pakistan. So it's not just one-way traffic from these countries to Pakistan. We need to learn a lot from Pakistan as well. So there needs to be a collaborative approach on that. And that is very important. Let's not forget that we do not know everything. You guys are doing fantastic work in Pakistan right now, and we would like to support that. Thank you.
Thank you very much, Mr. Tayyib Tahir. Mr. Amayub, if you are hearing me, please raise your comment.
Oh, thank you very much. Fantastic opportunity, I think, for the overseas doctors to come in and help the patients and the medical presidency back home. Just want to reiterate one point that I think one of the guests has already raised, is that of the communication. I think we need a focal person in Pakistan. I do realize our respected minister is very busy, and I think that's very fair. But I think the important thing is that we need some focal person whom we can get in touch. For example, APPNE needs to coordinate with somebody there, because that will facilitate a very easy work rather than going into the bureaucratic side of the things. So my only comment would be that if we can just have somebody there who can be easily approached by the organizations such as APPNE, and then we can coordinate with them, and depending on the specialty as well. And if that focal person can also point to us, for example, if I'm a cardiologist, I would like to have some cardiology person there to say, okay, guys, this is the area where we need your help, consultation or procedure-wise, or whatever it is. So I think that would be very much helpful in streamlining this whole Yaran Watan process. Thank you very much.
Thank you very much. Mr. Ayaz Abbasi, would you raise a comment, please?
No, thank you, Amir, for giving me this opportunity. And as you know that my specialty is emergency medicine, and been working with Pakistan for the last 5 years to get it recognized in Pakistan. So last year we visited 5 times and run courses in RMU, in CMH, in PIMS, and many other places. But one of the things which we have started recently, and it's just for Dr. Zafar Mirza, is that the Emergency Medicine Foundation program with the help of Royal College of Emergency Medicine. And this was because of some personal experiences where my relatives and my parents went to the emergency, and basically they were mismanaged. So that basically triggered me to go back, and do some work in emergency medicine. And this is a Royal College program. The only problem is that they are finishing in August for the first year. And there are 30 people who are being trained in RMU, and there are 30 more next year coming up in PIMS. But as there is no vacancies and there is no program and there is no service structure for emergency medicine in Pakistan, so I don't want them to get lost in the system and think that we have not invested time appropriately. The reason is that emergency medicine is not recognized as a specialty. And as I say, working after 30 years as a clinician, that the face of the hospital and the eyes of the hospital is the emergency medicine. If you mess up with the patient in emergency medicine, your mortality goes up, your sepsis goes up, your morbidity, and every sort of a standard of managing a patient starts from the beginning, which is your ER, and we need to concentrate on that one. Thank you.
Thank you very much. Mr. Hisham Haq, if you are unmuted, can you please raise a comment? I can't seem to unmute Mr. Hisham Haq from my end. I'm going to, just bear with me. I'm just going to try one more time. I'm going to request Mr. Osman Khan to raise a comment if he has a comment for the minister, please.
Hi, Assalamu alaikum. It's a very good initiative. There is no doubt about that. I did have initial difficulties in the form, that when you submit the form, it sort of disappears and you have to go back on it again and again. But then I contacted the email which was on the Yaran Watan program, and it was finally sorted out because it wasn't being saved. But obviously, as I've been going now for nearly since 2005, but that was all done on individual basis. Every year I go and operate in Shalimar Hospital or Shalimar Teaching Hospital, which covers about 1.2 million, very poor population of Lahore. So I think Yaran Watan would be excellent. I'm sure it will be run very well, because that will provide a platform, a basis for all of us to go. Maybe as a group, 4 or 5 of us would go over there and operate or help people instead of doing it on individual basis. So my congratulations to Zafar Mirza and rest of the team.
Thank you very much. I will now request Mr. Habib Haider to say a comment, please. Mr. Habib Haider. Habib Haider, we can't hear you. Habib Haider, although you're unmuted, I can't hear you. We'll have to come back to you. Mr. Zafar Iqbal, sir, if you would like to say your words. Habib, I'll come back to you.
Thank you very much, Amir. I'm a professor in public health, and it's just a plea to Zafar Mirza, really, and that is to use the public health expertise we have within the UK. We have senior public health consultants who are working and advising the government on public health policy around COVID, but also there are public health consultants who are working in NCDs and in social determinants of health. And it would be really good if the Pakistan government could use the Faculty of Public Health, which is our Royal College of Public Health, the Pakistan group, to inform public health policy within the Pakistan Pakistan system. It would be fantastic if we could create a public health system within Pakistan. So my question is, it'd be really good to, if you're interested in this, to have a point of contact whereby we can carry this on. We can actually take this further afterwards.
Thank you very much, Mr. Zafar. I will go back to Dr. Zafar Mirza. I'm mindful of the fact that Dr. Mirza has to leave for another event. So, Dr. Mirza, would you like to not respond to all of these comments, but I know you've taken them on board, but would you like to say some closing remarks before you go? And we will carry on with question time with Usman Mushtaq. So, thank you, sir. Dr. Zafar Mirza, please. We can't seem to hear Dr. Mirza.
He's still muted.
He's been muted. Just wait for me. I'm just trying to get Dr. Mirza unmuted. I think the system is very slow on this end. So just bear with me, Dr. Saab. Still very, very slow. So while I'm trying to unmute Dr. Mirza, Dr. Taj Hassan, would you like to raise your comment? And I'm trying to unmute Dr. Mirza at the same time.
Thank you, Amir. I just want to firstly congratulate you for bringing the group together, and also to the Minister for this excellent strategy. As my friend Ayaz mentioned earlier, so I'm a consultant in emergency medicine in Leeds and just previous president of the Royal College of Emergency Medicine. We set up that program that Ayaz highlighted. I think that is a helpful program. I think the other really important program that we're very keen on is the collaboration with the Pakistan Society of Emergency Medicine. And we've just set up an international group from 3 different continents of emergency medicine consultants. And what we really want to do is to do exactly what this program does, is to get government support to work with colleagues in Pakistan to do not only webinars, but workshops, and to have just a fantastic exchange of expertise. So I'm delighted by the program, but really would value the opportunity to have specific support from the Minister, not only for the development of emergency medicine, but how we can strengthen these links. Thank you.
Thank you. Dr. Zafar Mirza, I think you're unmuted now. Can you please come back to us? Thank you very much.
Okay, can you hear me?
We can now. Thank you very much. I think the system was getting it slow, so thank you.
Thank you for unmuting me.
Thank you.
Okay, I'll be very brief. I have to leave, but listening to all of you, these are quite. I can hear what you are saying in your words and between the lines. I take full note of everything, all the nuances which are there in what you are saying. But let me make a couple of points. One, that it will be a big mistake if Yaran Watan assumes that it will start from scratch. Absolutely not. Our starting point is by recognizing that how huge and immense contributions all of you and many of you have been making, not over the years, but over the decades. So I wanted to recognize that in my earlier remarks also, but this is very important. Now, how I see Yaran Watan is a kind of partnership. And this partnership is between government of Pakistan and doctors abroad. And it will not work if we do not have this partnership spirit in it. The other thing which I want to say is that the different initiatives that you have mentioned, some of you have also shown some concern about how to contact whom so that things can happen at speed and they do not fall in bureaucratic, inertia. So as far as this initiative is concerned, Dr. Usman Mushtaq is the point man, and he's currently in Oslo, but he's coming back soon. And he is actually hyperactive, sitting in Oslo about this initiative. So anything which you feel is not moving as you wanted it to move, just contact him, and he will, make it happen. And he has a very vibrant team of young people who are helping him. So. And we are very conscious also that the early successes this initiative would mean a lot because they can have a snowball effect. So we are very conscious about it. So anything which you are feeling that is stopping, just please let us know. I was scrolling through the different comments which have been also rolling on the sidebar. Very good ideas some of you are giving. I want to particularly mention one point which Dr. Shahid Rafiq of APPNE mentioned. And he said that there are programs which require a higher level and a different level of engagement. Absolutely agree. And I'm very willing and very happy to, you know, uh, engage with you on those programs. Uh, and I think that the iron is so hot at the moment, we should strike it from all possible angles. I always say in my talks these days that I think in the human history, public health, communicable diseases, prevention, health system, healthcare, disease surveillance, these are the words which has never got that kind of political attention as they have received in the last 12 weeks. And I think that this attention must translate into something very tangible. And I'm talking about the future of healthcare in countries like Pakistan. And our Prime Minister always reminds us about this in almost every meeting these days, that what a great opportunity that all of you have got to do something meaningful, sustainable for the people of Pakistan and for their future healthcare. So from that perspective, I'm very keen, and my team is very keen that we engage with you. Anything small, anything medium, anything big, which can contribute to the future of healthcare, not just for the COVID-19, but the future of healthcare in Pakistan. Some of you mentioned about, for example, emergency medicine. Yes, let's establish this as a discipline in Pakistan. Let's work from policy angle on it. Let's work on operational side of it. Let's work on the creating positions in the hospitals for this and give that recognition to it. And again, if not now, when? I mean, emergency medicine, if not now, when? So you will find us very keen to engage with you and to support you so that you can support us. Let's put it this way. So I would be leaving just with one request to all of you. Whatever you have been doing or currently doing, try to use the platform of Yaran Watan. This would be the best way to promote it. It doesn't require any money. It doesn't require any resources. It is just using the platform and promoting it. And it will have, a snowball effect among the diaspora as well as in Pakistan among the doctors community. So I will be, I'm sure Usman has taken notes of everything which has been said and all the comments. We'll be getting back to individually to some of you as I have taken notes myself as well. But thank you very much once again for inviting me. I'm very thankful to Nafis Zakia Saab for the comments that he made, and he's very right. Here is another kind of opportunity for example, a new markets and exploration of new markets for locally produced personal protection equipments. For example, I mean, when we started, we were just a couple of weeks back, we were importing everything, PPE. Currently, we are already in a position to start exporting them. This is how the business people have risen to the opportunity. So there are huge and various kinds of opportunities which must be fully exploited. And we can engage in more than one ways. So thank you very much once again, Dr. APPNE. I wish you good luck and to your colleagues. And I hope to have further opportunities to engage with you. Thank you.
I would like you to stay online just for a minute, sir. We have two more comments, one from Mr. Iftikhar, Sayyid Iftikhar, and then from Mr. Wasim Ahmed, who is representing nurses. So I'm just mindful of your time, but if Mr. Iftikhar can come in first with a short comment, and then Mr. Wasim Ahmed. Thank you, Iftikhar, sir. Sayyid Yusuf Iftikhar. Mr. Wasim Ahmed, if you can hear me, please go ahead with your
Yes.
Yes, please carry on.
Assalamu alaikum and good afternoon from London. Alhamdulillah, it's very excellent and congratulations to Dr. Mirza and Dr. Usman for this Yaran Watan. Really, we are a Yar of the Watan. We are every day remembering Pakistan. We are praying for Pakistan, and we are very happy for Dr. Zafar Mirza, how he is managing COVID. And I'm also recovering for my COVID, feeling little bit weak, but still committed for Pakistan. And Alhamdulillah, Allah has given me sehat. And now I just want to make the nursing. I was there in President House with Dr. Arif Alfi last year, 8th January, and in the summit, and he announced the nursing and midwifery year. But I don't think so. We have done a lot of things, but Dr. Mirza can explain. And we are here like more than 3,000 nurses, majority of trained in Pakistan, working in UK. And you know, all my colleagues, the consultants, doctor, they respect very much nurses. And we see excellent doctors here in Ireland. I've been to many times and many other countries. Allah with me nursing took me 40 countries. And now I want his response, what he's doing for the nurses, how we can contribute. And I'm the founding president for APPNE, UK, and we have foundation also now. And we are working in small level, but Amir Kiani, the previous minister is gone. We have quite good commitment with him, but I'm hoping to work with this and hoping to work together.
Thank you for your comment, Mr. Wasim Ahmed.
Wasim Sahab, you said 3,000 nurses in UK?
Yes, sir. Yes, sir. Pakistani origin and Pakistani, and overall maybe more than 10,000 all over the carer, radiotherapists, physiotherapists, speech therapists, and many, they are in contact with me. And I have more than 30 WhatsApp group, which I am running from UK.
I can only say this, Wasim Sahab, that you are so important that I would like to have a separate video conference with you soon.
Thank you, sir.
Shamak, would you like to say thank you to our guests because you've been helping me very, very hard on this project. Mr. Shamak is our social and corporate secretary. So would you like to?
I was very interested in having Wasim Sahab on board as well in terms of his nursing contribution. Now, one of the ambitions that we have from APPNE and from the merit program is that we would like to make sure that we upskill primary care workers and primary care workforce, which is not just GPs, but our pharmacists as well as our nursing, because unless we have that tier system over there as well, we are not going to be able to succeed as in whatever we want to do. So Anbai has been very much after me to try and sort of like lead on these things. He's been mentoring me on this sort of thing as well, but I think the time for this is coming. One of the biggest challenges that I feel that why we will probably not succeed is the fact that we have a monolithic organization which runs all of postgraduate training in Pakistan. And what we're now trying to do is we're trying to bring over our Royal Colleges and our affiliates, such as the Royal College of Emergency Medicine, Royal College of GPs, and our colleagues in Pakistan are not liking it. Now, because of that tussle which is going to be there, unless there are separate colleges in Pakistan which are going to be able to deal with postgraduate trainings, much like what is the structure over here, we are unlikely to be successful. And we're already experiencing a lot of friction over there as well. And we're already experiencing colleagues who, when they go over there, they're not being respected and then obviously being talked down. And there's a lot of things happening in the background as well. So we have got quite serious concerns that although we are going to be able to leverage this opportunity that COVID has given us to use disruptive technologies, and we're already working with National Incubation Center on some projects, we are going to be successful come what may. But unless we have these structural changes in the background to help us, you guys are going to leave after a term. This is the nature of politics. We're going to be over here longer than that. And we're going to be continuing, and many of us are still striving. But we need to make sure that we have these structural changes within the envelope that you have been given in order to make sure that our future is successful. So that's just a comment for you from our end.
Thank you, Isham. Mr. Dr. Zafar Mirza, I am extremely thankful for your time. on behalf of myself and my team, APPNE. I'm sure everybody has really enjoyed your comments. And you've taken some comments on those. You're telling me that you've been picking up all the comments coming on our screen as well. So inshallah ta'ala, we look forward to work from we look towards your support and guidance to yours, to Usman Mushtaq and many others. Zakaria Saab is here as well. He's been extremely supportive of me. So thank you.
Thank you. Thank you very much.
Thank you very much. We shall carry on with the question and answer session. We have Usman Mushtaq with us still. And if you have any questions for Yaran and Watan related issues, please, Usman is your man. So thank you. Carry on, please. Nadia Bukhari, I'm going to unmute you now. Do you have a comment or a question for Usman?
No, I have given my comments, but yeah, we can have a conversation, Usman. I don't mind.
In that case, I'll move quickly on to Mr. Hanif. Mr. Hanif, you raise your hands if you want to raise your comment or a question, sir.
Yeah, my question is, I'm one of a cardiologist from Birmingham. So question to Usman. So obviously, looking at the long term, this partnership with Yaran Watan, I mean, I would suggest some of us would like to permanently settle back in Pakistan. So is there any facilitation Yaran Watan can do? I mean, at the moment, generally what happens, either you go to a government sector or a private hospital, which is not always an ideal situation. So I was suggesting, is there any initiative or thought there could be some special hospitals maybe built for the people who coming from abroad, and they can run and provide healthcare, and at the same time we can offer our skills and also train the future generations. Something I want to have comment from Usman.
Thank you. Usman, would you like to respond to that comment and question, please?
Yes, thank you so much, and it's actually quite humbling to hear you know, the wealth of knowledge and experience that all of you have, and having that in mind, I just want to repeat what Dr. Zafar said. I'm not sure if that was very clear for us, but at least in our engagements when we were building up the concept of the initiative, you know, we do not want to reinvent the wheel, and we are here to augment the fantastic work that has already been done by the diaspora health community. I mean, me being, you know, a second generation Norwegian Pakistani, I know already that, you know, within our community there is a lot of excitement. It's, even though if it's not organized. So just you know, make sure that you know, the ethos of Yaran Watan is clear for you all. That, you know, this is what we're how we are seeing things, and this is how our worldview is basically. There has been a lot of comments and a lot of really great questions. I'm not going to be able to reply to all of them. I would just like to say that conceptually and seeing how things work in Pakistan, we would want to build this initiative as with layers. So what you're seeing now is a very basic first layer. I would like to share the concept note, and Dr. Amir, maybe you can share the concept note with the participants here, where you will see the bigger thinking around what we want to achieve in the longer term. So what we want to do basically from the individual exchanges is to move towards more institutional work. And Dr. Shahid, you know, you mentioned this, and I was actually thinking about calling you over the past few days just to discuss more concretely on how we can start already now augmenting the work that you and your team is doing on the ground. We've already been in touch a little bit, and same goes for APPNE and other diaspora organizations. So just to let you know, so initially, you know, we will be focusing on catering for individual contribution. And very shortly, with the complexity that is going to be built into the platform and within the organization and with the initiative, we would be able to support institutional collaboration from overseas community to Pakistan, and that can take in many shapes and many forms. But one of the shapes that it will take, it would be to augment the work that diaspora organizations are already doing. I think when you, and if you have the chance to read the concept note, it will become a little bit clearer to you that we do not only see, you know, the diaspora health community as medical doctors only. And Wasim Sahib, you know, it's very humbling to hear from you. And I can just mention that, you know, Dr. Praveen, also, you know, an academic, a nurse who is also an academic, we identified nursing and pharmacists and a few other select groups as key groups of health professionals that we want to target through this. But how we're going to do that, we're still in the process, and we're learning from basically you guys. And this is, you know, the way that we want to build this as well. I would like to say that I have several of my team members that have joined this call as well. We've been taking notes. We will be following up with you, some of you individually. When it comes to particular projects that are already running, feel free to get in touch with us directly, and then we can try to see on how we can already support that. When it comes to so the final comment that came in terms of settling in Pakistan, the way that we are thinking at this moment, and this will change inshallah with time, is that we are focusing now on short-term volunteer contributions, because those are the easiest ones. So this is like the low-hanging fruit. But obviously, you know, one of our sinister thinking behind this is that we actually can attract more permanent, or we can escalate brain gain towards Pakistan. So we haven't, you know, we haven't tapped into that at the moment, but it will come into the future. So what I'm also asking for is your support, mentoring, and also patience as we build this forward. Thank you so much.
Dr. Farhan Rashid, your question, please.
Right. Thanks, Amit. My question will specifically be towards Usman. Usman, one thing which hasn't been mentioned in the whole discussion over the last 2 hours is there's a lot of work which is already being done by different non-governmental organizations like the Midland Doctors Association, which is already providing a platform for overseas doctors to go and train our own doctors back home, as well as provide training as and when required. Especially in the current COVID crisis, Midland Doctors is already running a virtual training program to train the doctors to deal with COVID crisis and learn from the experience which we have, like myself, who works as a consultant surgeon at Hammersmith Hospital at Imperial College. And many people on this panel have already been part of that organization, including Professor Shamim, I can see, and Dr. Amjad Peracha Saab, and Mr. Iftikhar, who's the chairman, who has left. They've already had a platform, and they are utilizing that platform in the current COVID crisis to give whatever we can give back. And I think listening to Yaran Watan program, I think Yaran Watan can immensely benefit from getting in touch with those organizations and learn from their experience and provide them support as and when required, so that we can mutually benefit from it.
Indeed. Would you like to respond to that, Usman?
Yes, thank you so much. Noted, and I would love to learn more about the initiative. And again, like, you know, we are very cognizant of the fact that there are many efforts that are already going. So any way that we can support already at this moment would be great for us, and it would be great early success. Thank you.
Thank you. Iftikhar sir, would you like to ask your question, sir?
Is it me? Yeah, thank you. Firstly, I would second Farhan's comment about it. I have been to that hospital, and I can reassure all of you, if anybody wants to try, I spent 2 or 2.5 days down there and operated, and I found no difference in the equipment, in the theaters, in the support you have, as I would have operated in UK. So that's a wonderful hospital, that very well equipped, and you would feel so much at home that even the tea bags were from England. So it was a wonderful experience down there. And I cannot help but add to Dr. Wasim, that is about the nursing care and the nursing professionals. During my little stint in the hospital, I was served with 2 Muslim nurses, and I am so humbled and so grateful to the level of the professional care they gave me. They were just amazing. They were simply, I cannot have enough words to thank the nursing and the paramedical staff the way they took care of me. So thank you very much, Wasim Saab. Your fraternity is doing wonderful, wonderful job there. Usman, the question I have for you is whilst we somehow, being a lot of professionals around here who work in clinical medicine, we tend to slip away from the importance which this current crisis have given us about the public health. It is extremely important. We have our own concerns in UK, but I think that's a purely UK-based thing around public health. But I think that has got a vital role to play whilst you find your feet in the health system in Pakistan, which is a challenge in itself. But if you get the direction right from the beginning, I think that is a wonderful fundamental pillar to rely on whilst you develop into Yaran and Watan.
Thank you so much. Usman, would you like to come back to that question, please?
Yes, that's I completely agree with you. And in fact, I mean, I see Yaran and Watan as a public health project. And I can already mention that already now we have volunteering opportunities directly linked and directly trying to tap into public health professionals with the Health Services Academy and the official work that the government of Pakistan is doing on COVID projections and modeling and NPI's non-pharmaceutical intervention understanding of their efficiency. So already now, I mean, we're like, you know, we're fully cognizant of the fact that public health professionals needs to be on board, and the entire, you know, initiative is a public health initiative.
Thank you. Mr. Shabi Ahmed, please, you raise your hand.
Ji, Assalamu alaikum, everyone. I've just been asked to relay two comments which have been raised by people who could not speak, but if Dr. Usman can pass my comments further to Islamabad and further. Number one is the fact that people who have returned to Pakistan from various places in the world are having quite a lot of difficulties in the quarantine facilities back in the places where they have landed. The testing facilities as well as the boarding and lodging facilities are quite questionable in certain places. So can you please kindly ask authorities on ground in Pakistan to look into that? And the second comment that has come to me is that the ventilator facilities, wherever in Pakistan you are, especially in the bigger cities, 1/3 or maybe 40% of that would be in the government sector, and the majority of that is in the private sector. And the private sector is not at all cooperating with the health authorities on the ground, and people are struggling and suffering because of the availability or the non-availability of the ventilators in Karachi, in Lahore, and in all bigger places. So can the government take over these ventilator facilities at least temporarily for about a month or so, or maybe give some assurances in terms of financing them, because valuable lives are going to be at risk because of the non-availability of these ventilator facilities. Thank you.
Thank you, Shabi. Usman, would you like to come back to that question, please?
Sure. I mean, these are COVID-related, very specific COVID-related questions. But I can quickly mention that when it comes to the policy for incoming passengers, that is being revised quite frequently, actually more than twice a week, by the National Command and Operations Center, and the policy currently, basically on how we avoid further spread. I mean, so is the fact that we're having quarantine facilities as hotels. So most people that fly in will check into a hotel and their test will be taken. And this is especially what's happening in Islamabad. I'm slightly uncertain what's happening in Karachi. The operational side of it actually is not under our domain. It doesn't fall under the Ministry of Health. The operational domain is within the other institutions. And I know for a fact that it's a complicated challenge, but given these circumstances, our reading of it is that we're still doing reasonably well. It's not perfect, but it is as good as it can get with those limited resource constraints. Secondly, when it comes to questions around ventilators, we have done a quite extensive mapping of the ventilators around the country. It has not been easy, let me tell you that. There are local agreements in place with the private sector, and we have a good understanding of how much ventilators that is in the private sector. The public sector itself, based on our projections, we are procuring ventilators and training healthcare workers for those ventilators currently. And I can just give you the latest figures. there are roughly 45 to 50 people that are on ventilators in the entire country. And that is, more than 2 months into the pandemic in Pakistan. So we're projecting that our ventilator capacity, even with the rise that we're having, will be more than good enough leading into the summer. And inshallah, by that time, there will be a batches of hundreds, maybe up to thousands of ventilators that are being procured through various sources, and healthcare staff that is being trained to handle them. So we're currently in the immediate future not too concerned about the ventilator capacity in the public sector.
Thank you very much, Usman. I will say thank you very much to Irfan Akhtar, who has taken us a lot of time out today to be part of this. And you must rest. I'm very mindful of it. So thank you, Irfan, for joining us. And we'll carry on for another 5 more minutes, and then we'll call this a close. It's been extremely fascinating, extremely useful for all of us. I'm going to ask first Professor Syed Yusuf Iftikhar, if you are back online, please wait for us. There's one more question for Parveen Ali, and then I'll come to you. So Parveen Ali, if you can hear me, please raise your comment or question. Parveen Ali. Parveen, you are now unmuted.
Yeah, thank you. Thank you so much for everything. And I think that's a really great initiative. I've had a chance to talk to Usman and colleagues at Yaran Watan to kind of give my views, basically. Thank you for saying that, talking about nursing and other professions. And I think language is very, very important, because we often talk about, and even the form is developed in a way that it just only talks about medicine. So which is okay, but if you want to include other colleagues into the like the work process or their contribution, it will be very useful to change the format, or to make it a bit more inclusive, so people see it that they have got some contribution as well, which I've already fed back to colleagues, and I think that's would be really useful. So yes, there are quite a lot of nurses in the UK, and there are quite a lot of us who are doing a lot of work here and already with Pakistan, and will be more than happy to contribute in any way and shape we can do that.
Thank you, Parveen. May I please request Dr. Syed Yusuf Iftikhar, if you can still hear me?
Assalamu alaikum, Amir. Yes, I'm here. I'm here. I had to attend another meeting, therefore I had to issue here. Usman, you have been talking about the number of ventilators you're talking about. Okay. The issue we have in Pakistan, which I'm sure you must have recognized, is that there has been brain drain for a number of years. And the guys who are sitting here, we are all part of that problem. But the major brain drain which has happened in the last 20 years is from the anesthetic department. Now, all those guys who get training in middle grade, they all leave for Saudi. We have got hundreds and thousands of anesthetists working in the Middle East from Pakistan. And we don't have the trained people in Pakistan to actually run those ventilators. It's no good having ventilators. It's no good having engineers who will mend those ventilators. It's people who will manage those ventilators. And you need top quality people. Therefore, there's a need for a very urgent and on a war scale ethos to get people involved from the West who are at the top of anesthesia and train people locally. As you said that you are training 45 people or 50 people, train people who already know anesthetic, train them to a different level to manage intensive care.
Thank you, sir.
That will serve you well now, and that will serve you well in future as well.
Thank you, Iftibari, as you call him.
Thanks. Take care. Yeah. Thank you.
Thank you. Mr. Shahid Rafiq, would you like to raise your question and comment? You've been waiting for a bit.
Ji, Assalamu alaikum. Thank you, Usman. I'm available anytime if you want to chat. I have your cell, if even texting. But really, the previous caller, I echo the sentiment that what we are trying to do is the vent management course, and this is the need of the hour. This is it. This is the time. I hope that Pakistan does not go through a bigger surge, but in case it happens, and it's all about preparedness, in case it happens, there are not enough people to run those ventilators, whether you have refurbished them, whether you have, purchased them, or China has donated, or whatever the ventilator quantity is there, but who's going to run them effectively and who's going to manage the intensive care unit principals effectively? So that is why I know that there is a team in Pakistan that has a target of training about 1,000 non-intensivist people with an intensive care unit course, but so far they have done 200. And we've been talking to them, and now there's a stalemate. So that kind of frustrates. And I already talked to Amir, and you know, there are a lot of people in UK who are very well trained and can help with the Pakistani team. So we do not want to take over any institutional setup or a group in Pakistan. But I think in the future, if you, that's what I was talking earlier about the project level or a programmatic level discussion. If you from the beginning, meaning government from the beginning, involve, say, APPNE or UK people, US and other areas of the world from the beginning and bring them on the table, I bet you that effort will never be stalled, because we kind of are trained not to wait too long. And so I guess I'm not blaming, I mean, Pakistan has very talented physicians, very talented and very good people. There are maybe programmatic issues or organizational or logistical, but that's where my suggestion is that from the beginning, if you start a project, bring APPNE on board, people from UK, APPNE from US, from the beginning, so that that program does not stall and meet its timeline, intended timeline. Thank you.
Thank you so much. Shahid Latif, would you raise your question, please? And then I'm trying to unmute Usman. Seems to be okay. So if you take this question from Shahid, then you can come back to all three questions together if you can. So Shahid,
thank you, Amir. Thank you very much, and assalamu alaikum again. Usman, just slightly on a different tilt, if you like. I just wanted to raise some of the things in relation to the issues related to the BAME community again in the UK. You know, the number of people being infected and the number of individuals who've died. May rest in peace. Now, one of the myriad of components, there's myriad of components or reasons for this, and one of them is in relation to the communication skills of individuals and their lack of assertiveness to be able to talk about how they feel, etc. Can I mean, we often, myself and colleagues are often gone back to Pakistan and raised issues in relation to training in assertiveness training, communication skills, etc., and how East and West meets, if you like, and understanding the concepts. And I just wonder whether you feel from a medical, not only a medical perspective, but I'm sure my other nursing colleagues and pharmacist colleagues would say the same, that professionals coming here and also professionals in Pakistan, how much they would benefit from mentoring, mentorship in relation to communication skills, assertiveness training, etc. Thank you.
You all please mute your mic.
क्या कर तुम क्यों आती कि तुम्हारे क्या डिस्कशन हो रही है? नादिया ने जो कहा है
ये कहा था ताहिरा
क्या किया था तुमने?
ताहिरा चिकन बीफ बर्गर रखा
Everyone's been unmuted.
I think Zoom has got fatigue now, and I think that's good enough for us not to buy
project. Dr. Amir, I think it's time. I think this is the call for.
So Usman, can you hear me?
Yeah.
I'll just say we ran into some technical difficulty there.
Amir, one question, if you allow me. I know might be jumping the queue.
Yeah, Khalid.
Yeah, one question from Usman. I know it's kind of same thing which been echoing from the last few colleagues were mentioning. We all like to help and been helping. In fact, we all are doing for the last number of years. It will make some difference of channelizing that effort and will be kind of same impact, but main impact will come when we change the local system. There are a lot of what we count as compared to the local system is a very small percentage. So is there any thought process of training or changing the practice of the people in Pakistan already doing? And all doctors, nurses, that's COVID hopefully will be over soon, but then what's the future prospect on this?
Amir, can I ask the same one question on the same line?
We'll take other questions, please. We'll take comment from Habib Haider if he's online. He's raised his hand as well for a bit now. So Habib, can you hear me? If you can put your question forward, please, and then we take it together.
Yeah, thank you so much. I'm working as an acute medicine consultant and stroke medicine and one of the district general hospital, and I'm part of the COVID assessment unit. So my question is that when this COVID pandemic will be over, because obviously the main project at the moment for the Yaran Watan is the COVID, basically. So I'm more than happy to provide my services for the COVID telemedicine consultation and the further management plan. But when this COVID will be over, I'm a stroke consultant as well. And what I realized that in Pakistan, the stroke services are very minimum. And especially the world is advancing, and there are so many things regarding the stroke thrombolysis. So I would like to share, is there any possibility to introduce stroke thrombolysis services through the Yaran Watan?
Just bear with me. Usman, if you can come back to that question.
Yeah, so there was a lot of various different subjects that were raised. I just would want to start off with the ventilator capacity and the training. So as you know, Dr. Shahid mentioned, there is a program going on in the country that was started a little over a month ago, which is led by General Aslam, a very well-known pulmonologist who is working with both provincial and federal government to train. The target is 5,000 non-critical care workers on how to operate vents. And I spoke to General Aslam about this, and I had the understanding that there had been conversations with APPNE in terms of providing a back-end support. Actually, they put out a listing on the Yaran Watan as well, and we have recruited some critical care specialists that can provide this back-end support to not the people that are going to operate the vents, but the people that are going to support the frontline workers and their support. So it's like a third layer of support. And the requirements actually weren't that much. And I'll follow directly up with General Aslam, Dr. Shahid, and I will let you know about that. So just to let you know, there was a very early recognition that we did not have people that could manage ventilators, and a program was initiated, and it's slowly producing results. When it comes to comms and how to make sure that we expand and enhances and the way that health communication is done, I think that's a fantastic idea. So would love to talk more in terms of how we can facilitate that. Same goes for the last comment on stroke. Would love to understand how this can be relevant and in this work. I just want to see in terms of the local systems. I think if you would have Dr. Zafar on here, he would have spoken about this for hours in and hours out. That his kind of brainchild in terms of transforming the healthcare system in Pakistan and introducing universal health coverage with the focus on primary care. So that project is in pilot. It's been rolled out in Islamabad Capital Territory with the select districts in various provinces. Unfortunately, COVID rolled up and hampered all progress. Like the project hasn't really stopped. But I think that's a conversation for another webinar, inshallah.
Thank you.
Thank you. Imran Gangro. We're coming to Amir Khan after this one.
Thank you, Amir Bhai. Thank you, Usman. Just a comment, really. Thank you for updating us on the ventilators. But a lot of lives have been saved by non-invasive ventilation as well. And as you know, in Pakistan, it's very difficult to find, in big hospitals, there are no specific, say, pulmonology wards or so, but it's a general medical ward. So it would be good to have some sort of fast-track training to the medical RMOs or something, some people, and provide those non-invasive ventilation training to those people where a lot of people can benefit from that. So it's just a comment really, because I know personally that some bigger hospitals don't have even non-invasive ventilation. So that's just a comment from me.
Thank you. Thank you.
Amir Khan.
Just a quick comment and a suggestion at the end. I think we can use this crisis as an advantage, to our own advantage. This is a great opportunity. You've got such a big wealth of knowledge sitting outside Pakistan as well. We are all prepared to give you, use technology and give tutorials and give training sessions. There are people who are dying to do that from here. Why don't we, to give a kickstart to Yaran Watan, if you open that, different timings for people to just attend them, you can give a kickstart to the whole thing. And that'll at least give a positive type of a feed to people sitting outside as well as in Pakistan, that they can benefit. You've got a fantastic group of clinicians in Pakistan. Look, I've been doing training in Pakistan for the last more than 15 years now, and I've found technically they're too good. The only problem is they just need to be given a further push onto the right track. There's no rocket science. We're not going to do anything different, but there's an opportunity here because we are all prepared for it. So please take this as an advantage. This will give you a kickstart.
Thank you very much.
Thank you.
I'm going to draw this to a close. I would really apologize to the ones who have not had a chance to ask the questions, but please write them in and I will take them back to Usman, Mushtaq, and to Dr. Zafar Mirza. So please do write them in. And again, apologies if we haven't been able to take your question on board. We have gone well over time. We were going to finish at 5:15, but here we are, nearly 6:15. So we must thank Dr. Zafar Mirza for his time, His Excellency, the Ambassador of Pakistan to Ireland, Mr. Shujalam, Mr. Nafiz Zakaria, His Excellency, the High Commissioner to UK from Pakistan, Mr. Khalid Khan, the President of APPNE, Mr. Shahid Rafiq, who joined from APPNE as APPNE Merit Chair, and Usman Mushtaq. Again, I would really like to thank you for what you are doing for the country and obviously taking us on board as Pakistani diaspora medics. We've heard so much here. I was a moderator, so I didn't get a chance to ask the question, but I will leave my questions for another day. I'm thankful to my team, the executive team. I'm really thankful to the trustees, Mr. Amir Khan, Azabasi, Shahpresh is still recovering and still managed to stay for the 2 hours of Shahpresh. I'm really happy to see you here and looking well. We are missing a couple of our colleagues, those who are not couldn't be here. My team is immense. The team we are working with APPNE is fantastic, right from my General Secretary, Mr. Irfan Akhtar, all the way down to Naseem Waraj, who is our media lead. So we have the expertise here, Usman, for us to work with you together, not just as medics, but in many other specialties, in many other areas. You'll be surprised what doctors can do when they put their minds to it. And finally, our nursing friends, Mr. Wasim, I'm so thankful that you are here. And to represent the pharmacists, the invited large, Nadia Bukhari, who also joined us. So particularly Nadia Bukhari, we are going to work together. So I hope we can all work together collaboratively in the future. So if you have any last comments, Usman, then we'll call it thank you and goodbye to everybody.
Thank you so much. Thank you so much. Really, really appreciate the effort, and thank you so much for taking the time. I really, really appreciate this. Bahut shukriya. Thank you so much, Dr. Amir, yourself as well.
Okay. Bye-bye.
Okay.
Bye-bye.
For us, and Irfan for his lovely work with Yaran Watan, because he's the one who actually was behind it in getting us on board with APPNE on the Yaran Watan project. So Irfan and Hisham, thank you very much. Thank you.
Thank you.
Thank you, everyone. Thank you, Usman.
Okay.
Fantastic contributions, everyone. Well done.
Thank you very much.
Thank you.
Thank you, everybody. Take care.
Well done, everyone. Thank you.
Thank you very much. Bye.
APPNE Zindabad.
Well done, guys. Well done.
Thank you.
Well done, Team APPNE.
Well done, everyone. Thank you.
Thank you, everybody.
We are leaving now.
Thank you, Shahid. Nearly everybody's going.
Thank you, Amir.
I'll be the last one to leave. I'm the host.
You've been a brilliant
Thank you very
host,
much.
Amir.
I'm also going to be hanging on right till the end. Thank you, everyone.
Very well done. It was, I think it was very well run and very well managed. Thank you very much, the team.
Most welcome. Sir, not without the guidance and support, I must say. Shah Bhai, Abhi Bhatt, Amir Bhai, or many others. Shahid is a fantastic support all the way through. And
Thank
so
you.
he's here. He's a local support.
Teamwork.
Let's keep it up. It worked out very well. I think we need to arrange more seminars like that now. This is the best.
And I think we must commend our team, because this was a conversation on last Sunday, and here we are on Saturday. So what we achieved in 6 days as a webinar, it tells a lot about what we can do.
Amir, as they say, upwards and onwards, inshallah.
Upwards and onwards. Definitely.
We must thank
Well
our
done,
friends
guys.
from Norway and Germany. We had people from Germany listening in, Norway, Ireland. So we are truly Northern Europe.
अब इस तरह करें, आप मीटिंग कर लें मेरे ख्याल में.
Enjoy yourself.
Okay, guys.
Well done, sir. Well
Take
done.
it.
Appreciate it. God bless you. Allah bless you. Now, Aftari time. We are hungry.
Well done, Khalid Saab. Khalid Saab, well
6 o'clock. It's only 6 o'clock. अभी तो और time है.
जी. मैं तो ये मुसल्ले पे बैठा हूँ, आपके लिए दुआ कर रहा हूँ, और नमाज रह गई थी, नमाज पढ़ रहा था. जज़ाकल्लाह.
बहुत बहुत शुक्रिया. बहुत बहुत शुक्रिया वसीम साहब.
Okay, take care. Be safe and be at home. Please. Encourage others.
Thank you, Kamla, for listening in.
Chalo, Khuda Hafiz, everyone.
Shukriya, Dua ji, at the beginning.
Thank you.
We appreciate what you did for us.
Okay, Allah Hafiz, Amir bhai.
Allah Hafiz. Allah Hafiz.
अभी भाई आप बंद कर दें तो सारा बंद हो जाएगा. अल्लाह हाफ़िज़. I think आप यही करें.
मुझे अमीर भाई को बात करनी है.
अच्छा.
Okay. Assalamu alaikum. I'll call you later. Amir bhai, I will call you after this meeting.
ठीक है, बात होती है. खुदा हाफिज भाई. खुदा हाफिज.
अल्लाह हाफ़िज़.
Shab bhai, thank you. Sham, thank you again. And Shaban Khan listening in. Thank you, Shaban.